He was in the green room. He's got his makeup on. We're going to put his microphone on. He's Dr. Michael Lim, cardiologist with SLU Care and SSM Health SLU Hospital. Good morning, doctor. Thanks for joining us here on the Big 550 KTRS.
Good morning. My pleasure.
You want to talk about the Affordable Care Act, a.k.a. Obamacare.
A.k.a. Obamacare.
Yeah. What's going on?
Well, I think what struck me this week with respect to different topics in healthcare is we have debates and we have people that are talking, and I think the people that are doing the heaviest lifting are the people doing the fact checking.
Aha.
And so what I wanted to do was kind of lay out a few things in terms of information about the Affordable Care Act, because what's happened is become a political hot potato.
Right.
And we're using the term, but we don't necessarily understand it.
And we don't know what the facts are.
Right.
And the good, bad, and the ugly.
So a couple facts. One, we spend over $3 trillion a year in this country on health care. And so that's about 18% of our entire economy that's spent on health care. So is it a significant issue? The answer is absolutely it's a significant issue. And when you're talking about $3 trillion, when you're talking about the health of our folks here in this country, I think that it deserves a lot more attention and a lot more than just good or bad, keep it or repeal it.
Right.
And so then we have to take one step back and we have to talk about sort of the basics of health insurance.
Excuse me.
Like Kelly needs some. Sounds like she's
Or
getting
some
a little,
manners,
getting
not
a little-
coughing in my face.
Getting a little sick.
I coughed in my arm, so.
But remember, so in 1965 sort of started the modern era of health insurance in this country when Medicaid and Medicare were passed. These
Right.
are government health care insurances that really set forward where we sit now. And so Medicaid covers children, Medicaid covers childbirth and maternal care, and covers the poor. And Medicare covers the folks in this country over 65. And those are basically single-payer sources. They're from either the federal or state governments. And then there's this big hole in between.
Yes.
In between when you're a child and when you become over 65. And this big hole had, before Obama took office, a huge number of people who are uninsured. And the uninsured, that can cause financial ruin to any individual if your health goes awry and all of a sudden your health bills become catastrophic. If you don't pay those bills, somebody has to pay them, and so that gets spread out across a lot of other people who are insured, and so that increases the cost of all of the rest of our health care.
There was also people who couldn't afford it.
Correct.
And there were people who could afford it who were not allowed to buy it.
Correct. And so there was a lot of controversy with respect to that, but I think the overall goal of the Affordable Care Act was just to try to increase the number of people that were covered by health insurance. And that was the principal goal behind the act. And it worked. It worked significantly. There's been a tremendous uptick in the number of people who are now covered by a health insurance plan.
Okay.
So principal goal, check.
Okay.
Now, there are some other things which are in there which are beneficial. So this pre-existing condition concept, where if you had, for instance, diabetes, which is a condition that doesn't go away, or if you've had a history of childhood cancer, these things now are no longer allowed to be used by private health insurance companies to deny somebody coverage. There's more preventative services that are covered. There's mental health and substance abuse things that are covered. Children of parents with plans up to the age of 26 now can stay on their parents' plan, and so that closes the gap a little bit more. These are all things that actually really happen. When we talk about Obamacare, this is the good side of Obamacare.
Right.
And those things worked.
The argument is that premiums are going up. My plan I can't get anymore. I'm going to a different doctor, and my deductible's through the roof, and I'm paying more for my health insurance.
Absolutely. So, there's no such thing as everything's all good. So there's bad things that are going on in healthcare, and that goes back to the $3 trillion in costs and goes back into the complexity of our healthcare system. And so, one of the things that prevented and has prevented for years and years and years a more substantive change to the overall health system in this country is actually how our political system works, which is fed by special interests. And so we have special interests from hospitals. We have special interests from pharmaceutical industry. We have special interests from insurance industry that spend a lot of money trying to protect their own personal interests, their own corporate interests. And that money is significant in terms of what can be written and what potential tough changes, which might be better for us, could happen or not happen. Next, this country has an unbelievably large amount of freedom to take advantage of things that are just inherently unhealthy to you. And those freedoms that we afford our citizens actually end up costing us a lot of money. We have unfettered access almost to tobacco, to sugar products, to sweetened beverages, to terrible foods. And over the course of 20 or 30 years, we can talk about tremendous success stories that we have in our hospital and other hospitals every day about how somebody had a massive heart attack and they otherwise would have died, and we can save their life. But that's cost. That's a lot of cost. We're talking about maybe about $1 million to try to save that gentleman or that lady's life, when the real cost savings would have been if that event never happened in the first place.
Since Obamacare has taken over, how has your job as a doctor changed, if at all?
So I think that there's a few different ways to look at that. From a doctor's standpoint, I can only speak for myself and not other doctors. And so it has to do, to me, when I start answering that question of what am I doing and why am I doing it? And so to me, the beginning and end of my job is to take care of folks, take care of patients, and be there as a resource for them and try to advise and help them have a better, healthier, and longer life. And I have been fortunate to be able to continue to do that. And within our practice, we've been able to continue to grow and thrive with or without Obamacare.
So it's very minimal effect on how you do your day-to-day job.
The changes with respect to what people sometimes attribute to Obamacare, and that includes us physicians, potentially unfairly, are, in 65, when Medicare and Medicaid were passed, we started this era, what's called fee-for-service medicine, which means, you get a chest x-ray and I'm going to charge you for it. Mm-hmm. So we pay for procedures. But then that devalues a whole lot of other things, and it actually puts the emphasis on the wrong end of the equation, because it puts the emphasis on the expensive procedures and the surgeries and the treatments rather than on prevention and talking and guidance, and those things don't work. And so what's been changing with or without Obamacare, actually probably more through Medicare, is the payment models are changing. And our reimbursement is undergoing tremendous amounts of change. And very soon, we will not be paid in a similar way that we had been before in this fee-for-service environment where I see a patient and that's X number of dollars that goes in.
And a lot of people complain that those reimbursements are going down and doctors are in all sorts of trouble, all sorts of issues, and we're headed for a big disaster because of those reimbursements.
Well, the sky's either falling or it looks beautiful. Depends on your point of view. But the change is inevitable. What's happened since the passing of Obamacare in the marketplace is that the average physician no longer works in a so-called private practice environment where the physicians own their own independent business and that business supports that practice. A lot of those physicians have sold those practices and now they are hospital employees. So they are employees of hospital systems. That's really, really been a major shift in physicians. With respect to reimbursement and that type of thing, and there is no question that when we talk about healthcare, people have always talked about, well, there's sort of the good guys and the bad guys, and the doctors have been labeled as part of the bad guys and part of the problem in terms of adding to the cost of medicine. And so there's been a push to reduce how much we get paid to do that. And these are all, but this goes back to where we started, right? You know, we're spending trillions of dollars a year on healthcare, so change really has to happen all across the board.
Wish we had another hour to talk to you, Dr. Michael Lim. This will not be the last time you bring this up, since it is such a major conversation, but we always love to hear what your thoughts are, since you're on the front lines.
I would urge all your listeners to really understand, from my standpoint and from your guys' standpoint, you know, healthcare is emotional, and we do value our own healthcare, and we would want the best for us and our families. But we need to be highly critical of the people that we elect and what's said, and we can't react emotionally. We need to push them to do the right thing.
In any of the last 8 years, have you come across any death panel?
No.
Which was one of the scare tactics that the people on the other side
that's what I mean with respect to looking at this unemotionally.
Right.
And so there's tremendous amount of business that goes on, and it hypes up every 4 years, certainly during election season, but they try to stir our emotions. And we need to stay based in fact, and we need to push for what we really believe is right and what should happen, and positive changes.
Dr. Michael Lim, cardiologist with SLU Care and SSM Health SLU Hospital. Doctor, you're always welcome.